Okay, welcome back. I'm Earl Stephenson Jr., Atlanta board certified plastic surgeon, and we're going to continue our series on face and neck lift, and we're specifically focusing in on the neck. Welcome to Sketches in Surgery. It's great to have you back, and we're going to talk about the middle neck in this video. I've done previous videos on the deep neck and the superficial neck. This is the middle neck, which focuses, in my opinion, on the platysma muscle, which is a very broad but sometimes very wispy muscle, but receives a lot of attention surgically. This muscle can be manipulated to improve the contours of the neck. So let's talk about this a bit. So if we were to look at the top diagram that I've illustrated here, and I'll try to zoom in a little bit and move over. There we go. Perfect. So this is if we were looking at somebody laying down, looking up toward their nose. If you were to take the skin off or look underneath the skin with a small incision here, like we perform in surgery to address the neck, then you would get underneath the skin for a distance and you'll start to see this really pinkish, very thin structure in people. And this is the platysmal muscle. It's a very superficial muscle, but it can contribute to poor aesthetic neck anatomy. And what I do with this muscle is we address it in several ways, and historically it's been addressed in several ways. If we were to look at it from the side, let me back out a little bit, then it would look like this from the side. So let's go back and here. So this muscle or this muscle, these muscles can be separated in the middle and usually are. And they can contribute to what we believe are neck bands on the outside that can be treated with Botox, or then if that is ineffective or the client is tired of using that modality as a form of treatment, we can move on to a neck lift, which would involve eliminating those bands, meaning altering the contour or shape of this platysma muscle. Typically, we try to do a couple of things to the platysma muscle. We try to use it to define the front part of the neck, and what I mean by this is just beneath the chin. We use it in the back part to really anchor and sharpen the angle of the lower jaw. So we'll use it to kind of anchor and pull skin back and really define the jaw. And there have been tons of methods to do that, and there are no right ways or wrong way to do that. Your board certified plastic surgeon will judge your case individually and decide what typically needs to be done. But here are a couple of things that are done or routinely done. So let's go back up to the top. So what we typically do is we find the hyoid bone, and we talked about that in our deep neck video. So I'm just going to draw, if we had x-ray vision, could look underneath the platysma, and there's a little bone that holds a deeper set of muscles called the digastrics. And again, that's in another video, but basically at the level or below the level of the hyoid bone, once we've kind of uncovered this muscle, which is just beneath the skin, so we kind of create this space just beneath the skin on either side so that we can see it, some surgeons will surgically cut this muscle, not all the way back, but a certain distance, and it depends on the person's technique and the anatomy of the client, but they will do that on each side. And this is called a myotomy, which is just Latin for cutting the muscle. And we create this myotomy, and this myotomy is created so that then we can do a couple of things. Now I use a different color. I tended to use black, but I use that for my hyoid bone. Just above, or just at the level this cut, we try to bring these muscles together with stitches. Stitches, stitches, stitches. That creates a smooth kind of surface to the underneath the chin, so you don't have these little bands. So we've broken up that band by cutting this muscle. The bands can be particularly strong in the middle. Seen on the outside is just these little banjo strings. So we've done that, and so we've created one uniform muscle just beneath the chin. So that's what we do there. And now, below this cut, we typically don't do anything, but behind this cut, we can take this muscle and we can anchor it back. And I'll show you what I've done there. So we take this muscle and we anchored it back. And we can do the same thing on the other side. We take this muscle and we can anchor it back with a stitch. And that typically is to the tissue near the ear or behind the ear to draw that neck skin in. So this is how it would look from a view if you were to look from underneath the chin. And typically, as the surgeon, I would be here looking down this way. And that's what we would do. So we would really work on the front part here, dividing this muscle just at the hyoid bone or below. Bring it together and make it one muscle to kind of eliminate any bands in this area to give us more uniformity and smoothness of the contour. Smoothness of the contour of the neck. And then from the side view, I'm just going to pretend we got kind of a facelift incision. From the side view, what we do is we anchor, and I'm going to zoom in. We take this muscle, we expose it underneath the skin to expose the front part of it. We get underneath the muscle on the back side of it to expose it so that we can anchor it with a stitch so we can draw it up this way. And when we do, combined with this kind of cut in the muscle at the hyoid bone, then we're able to reshape this muscle. So how does that affect it? So once I've done that, this muscle then is tightened because we've cut it at the hyoid bone. We've got our stitches. Doom, 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 doom. We've kind of gotten underneath it this way, and we've pulled it so that we can have a better contour of the neck, which would look like, back out. I'm reaching and looking and trying to keep things still. Here we go. Which would look like, I'm going to come up this way. I'm going to draw it a little bit backwards. A sharper neck. That's all we want to do with the platysma. There are other things you can do with it. You can, once we push it back this way, again, I'll draw a black arrow to represent that. Once we pull it back this way and anchor it, this muscle gets kind of covered over the angle of jaw, and it can add some bulk to the angle of jaw so that when we look at the skin of that area, we look at it, we go, wow, they've got a really pronounced, sharp, and I'm going to actually use this little thing right here that really sharpened things up. And now we've got this sharper, crisper angle of the jaw and jawline. So there are certain things, not only just to anchor in and pull it backwards to kind of pull that muscle and create that angle and flatten this out to create the angle, but we can also use it to kind of augment or bolster the angle of the jaw, especially when people have a weak or non-existent angle. That sharpness gives really great definition to the neck. So again, this is just a really brief video about the middle neck. The muscle in play here is the platysma muscle. It's the muscle that is the workhorse, or what we use primarily to help shape the neck. In our other videos, we'll talk about the deep neck and some structures there, which will also contribute to neck contour issues that can be addressed, as well as the superficial neck. Certainly, structures in that area need to be altered to improve the contour of the neck. So, neck lift is a complex surgery that requires board certified plastic surgeons to address many structures. And then this layer, the middle layer, the platysma, is the key structure. So again, this is just a variation and a small presentation about that muscle. Different surgeons have different techniques of how they want to handle the muscle to create the result that their client desires. If you desire a neck lift and you're here in Atlanta, or maybe you're not, you can always call our office and schedule a consultation in office or a virtual consultation. We take our time and pride ourselves in spending time with our clients, at least an hour consultation. Our consultation fee is $225, but we hope you get good value out of that in the form of attention to your story, making sure that you're heard, your questions are answered, and that I give you recommendations and information that can be useful for you. Not just with me. If you decide to go with me, that's great. I would love to work with you, but you may decide to go with someone else, and you can use that information to help you feel better about that decision. Or you may decide that this is not for you at all, no matter who would offer the work. So again, our job here is to make sure that you get good value for your time spent. The quickest way to schedule a consultation is to call 770-466-4700. I'll leave that in the comment below. And I would invite you to subscribe to my YouTube channel. I have a series called Sketches in Surgery, which you've just watched the video. We've talked about neck lift, we talked about facelift, I've talked about other videos, including male chest contouring, gynecomastia, and chin surgery or genioplasty. If you want to know about those procedures or any other procedures on my channel, please like and subscribe and hit the bell icon so that you'll know when there are new videos. Until next time, on Sketches in Surgery, this is Earl Stephenson Jr., your Atlanta board certified plastic surgeon. Thank you for listening and watching. See you next time.